doing today?
Hi, how are you doing?
Good. Okay. So my name is Dr. Varela, and thank you for joining me today to discuss my patient. As you all know, I'm a primary care physician, and I'm just trying to direct my patient in the right way. So I gathered you all here today because you all are specialists in neurodegenerative diseases, and I'm certain this is what we're dealing with today. So my patient is a 56-year-old male who I first began seeing about a year ago in my clinic. He complained to me about weakness in his arms and legs during his routine physical. So recently I saw him about 3 months ago, and he complained to me that his muscle weakness had progressively gotten worse, preventing him from lifting anything heavy, and even becoming short of breath while walking up the stairs. So I saw him again last week, and he complains now of difficulty swallowing, and he often has muscle cramps and twitches that have no direct explanation. I also noticed his speech was more slurred and since the last time I seen him. And his main complaint now is that his muscle weakness is just getting worse and worse every single day. So now, because I do not usually treat these types of diseases, I will admit that I don't have a lot of accuracy in diagnosing this. So since the muscles are being targeted, I am pretty positive that this disease is attacking the motor neurons. And I did do some research citing medical literature that I got to a point where I narrowed it down to amyotrophic lateral sclerosis. So I'd really appreciate if all of you could just help me confirm this diagnosis so I'm not misdiagnosing this patient. But my main questions are, how do you contract ALS? Is it contracted through a pathogen? Is it hereditary? What is the outlook, the prognosis? What treatments are available for my patient? And also if there's any current research that can help me understand the severity of the disease and the current outlook on this disease.
Okay, Dr. Varela. Well, Dr. Gonzalez, and based on the information you have provided about your patient, it certainly seems that he is suffering from ALS. Now, to answer your question regarding the etiology, unfortunately, the majority of cases of ALS are still unknown, but it may be hereditary. Research believes that some individuals may be genetically predisposed to the disease, but only after becoming in contact with environmental triggers. These include smoking, toxin exposure, and military service. These environmental triggers puts people in greater risk of acquiring ALS, but there is still no chemical directly correlated to it. On the bright side, I guess, sort of, ALS is not contagious, and it cannot be transmitted from one person to another.
Okay, I'm Angela, and we'll talk about a comprehensive treatment plan for your patient, which is going to include nutrition and all of the therapies, physical, occupational, respiratory, as well as social support in conjunction with prescribed medication. There are 2 medications that you can prescribe to your patient. The first is Radicava, which was just approved in 2017, so it's fairly new. We don't know too much about it, but we do know that one of the side effects is allergic reaction to edaravone, which is presented after it is administered. So once the medication is administered, he'll need to be closely monitored to ensure that he is not having an allergic reaction. The second medication is Riluzole, which has been around for many years, and research shows that patients feel better when they take this medication. They also feel like they sleep better. But when you give this medicine to your patient, liver function enzymes do need to be monitored. Also, physical and occupational therapies will need to be administered for your patient. You mentioned the muscle weakness. We won't be able to do anything for any damage that has already been sustained, but we can strengthen his unaffected muscles and increase his cardiovascular health. And this will fight fatigue and depression. An occupational therapist can provide therapies like wheelchairs, devices, and ramps and walkers. Then the last one I want to talk about is social support, because your patient will need that, especially as his daily living activities will diminish. He'll need especially psychotherapy, and you want to make sure that he has support at home.
Thank you. I'm Dr. Dolorosa, and I'll be going over the prognosis for this patient with ALS. So what is the likely course of this disease? Well, the outlook for ALS is it's pretty poor. with most patients dying from it, typically from respiratory failure. The statistics show that 25% at least live 5 years, and up to 10%, very few, live 10 years or more. One factor that worsens the prognosis is if they develop the disease later on in life. So you mentioned your patient is 56 years old, the outcome is not going to look as good as someone who developed it younger. Another factor that impacts the patient's prognosis is whether they inherited ALS. For those who inherited ALS, they are likely to survive only 12 months. For patients who lose muscle in their neck, it can cause a more rapid deterioration, which affects their ability to perform daily tasks, which ultimately leads to a shorter life. There's some evidence now that show people with ALS are living longer, at least partly due to clinical management interventions, Riluzole, a drug used for ALS, and possibly other compounds and drugs under investigation.
Hello, my name is Dr. Rodriguez. I am working with nutrition with the ALS Foundation, and one of the most common and severe symptoms of ALS is losing weight loss. And we generally instruct the patient to have a high calorie diet and taking more fats, proteins, carbohydrates in order for them to gain that weight that they lost. There was a recent study where 28 patients were going into a clinical trial. 4 were disqualified, and 24 were divided into 3 groups. Control group, high calorie, high protein, and there was the other one, high calorie and high fat. The high calorie with the high carbohydrates were the ones that succeeded, and successfully 8 out of 9 patients were the ones that gained 0.46 kilograms in their weight each month, meaning they are having their weight gain, meaning more survival rate for them. So that's what we want. We want to implement that. They need to get their food intake well, and in order for that, I know some of them have trouble swallowing. So easier way to do our clinical trial is we insert a rig tube into their stomach using an X-ray, and that's how we provide that they're feeding. But in order that they have a greater chance to survive.
Okay.
Hello everyone, my name is Omar Dominguez and I'm a neurologist at USF. So we've been doing research on the impact of expiratory muscle strain training, which is a type of respiratory therapy. As we all know, ALS eventually starts affecting the muscles that patients use to breathe, swallow, and cough. This can increase the chances of malnutrition, aspiration pneumonia, eventually increasing the risk of death by 7.7 times. And 85% of individuals are diagnosed with ALS will develop swallowing impairment. Considering the complaints that your patient is presenting, he seems to be in the moderate stages of ALS, and I think he would benefit from this therapy I'm about to present. So in this EMST therapy, we focus on the expiratory force generating ability, the swallowing kinematics, cough physiology, and airway protection in 25 individuals with ALS. First off, we had to get a baseline assessment on them, so we did 3 evaluations before the training began. In the first 2, it was patients were instructed just to go on with their daily activities, nothing too intense, and after the second evaluation is when the training began. So the training lasted 5 weeks, for 5 days in a week. So a session in a day consists of 25 exhaled force expirations, and a patient is to breathe into a sit up straight and breathe into a tube and trying to break that seal. This handheld meter, it detects the MEP, which is the maximum expiratory pressure, which is what we're focused on. So after all these results were collected, the patients did show a significant increase in their MEP. So here's some of the results after the EMST testing. As we can see here, when we measure the MEP, this was the first evaluation. Here's a second. And you can see the decline here. And after the EMST training, you can see it increased, and that's their maximum expiratory pressure. And same with the high-O displacement, which is used for swallowing. We can see an increase here after the second baseline assessment. So this is after the EMST training. So considering all this, I would suggest, Dr. Varela, that your patient will benefit from this EMST program. Okay, so now I'll be introducing Dr. Erica Bonds. Unfortunately, she couldn't make it to our meeting, but she'll be live with us today, talking about current research on stem cell.
Hello, I'm Erica Bonds, and the particular clinical trial that I found was the results were submitted September 6, 2017, so it's a very current one. It was performed at the Emory University in Atlanta. It's an immunosuppression study that was done via stem cell research on pre-diagnosed ALS volunteers over a course of 15 months. The first 6 months, 5 different drugs are administered, 2 intravenous and 3 of them by mouth. And the remaining 9 months are done just basically to document how each person responded differently to the drugs. Everyone responds different to the drugs. Everyone has different signs and symptoms when dealing with ALS. This one particular trial is considered a success in the research of ALS because they have a scale called the ALS-FRS, which is the ALS functionality function system. And that's basically the way that they measure the condition of the symptoms and the progress of the symptoms. So 5 of the patients that went through the surgery that were not on ventilators also showed that the symptoms of the disease slowed. It didn't stop, and it didn't progress rapidly. It just slowed it down. So that also was something to look into. And it also brought up the thought that maybe other things with ALS, like a sub immunity to some of the drugs, is something else to look into. So this is a great case study because I feel like it'll make a good impact on future concoctions, and by seeing the immunity that is within the person that did show progression, maybe they can use that information to help with future patients.
Yeah, I want to thank all of you for coming and joining me and discussing all of this information. I think now I feel very confident discussing the next steps with my patient, advising him on what to do next.